again. In today's tech-savvy world, we can get pretty much anything we want at a moment's notice, but when it comes to having children, couples find they usually have to wait to conceive. So today we've invited Dr. Angela Thayer from Seattle Reproductive Medicine to share her top 10 tips for becoming pregnant as quickly as possible once you're ready. Welcome back.
Thank you.
So this is not quite like David Letterman's top 10 list.
No.
This is very serious. So the first one you say is watch your weight. Why is that important?
Yeah, if you're underweight or overweight, it can impact your ability to ovulate. So it's a good idea to just be right in the middle.
And so at what weight should somebody really be concerned? How do you know if you're too thin or too overweight?
Well, if it interrupts your menstrual cycles, that's definitely a time to come in and be seen, because there could be some endocrine issues going on that's disrupting the communication.
So for example, for serious runners, sometimes they notice this.
Serious runners, or for a body mass index, a lot of times above 30, we'll start to see fertility rates going down with overweight.
Okay, if you don't know your body mass index, you can just go on the internet and plug it in and find out. Number 2, start now with preconception planning. What's involved with that?
Well, it's a good idea to be on folic acid to lower the risk of neural tube defects. It's a good idea to be eating a healthy diet and exercising a little bit. It's a good idea to check to make sure you have immunity to rubella and varicella. Doing that through your primary care physician or OB/GYN is a good place to start.
So getting ready. The neural tube defects are like spina bifida, that sort of thing? Okay. Number 3, treat underlying issues. What would be some examples of those?
So underlying issues would be things like thyroid disorder or polycystic ovary syndrome, things that could make you less fertile and interrupt ovulation again.
Would you know about those things, or would that be caught in a physical?
You know, you may or may not. Again, if you're not having regular cycles, you're probably clued in that it's going to be harder. But thyroid, we actually do a blood test to screen for that.
Okay, you say start timing your cycle, because not everybody is 28 days on the dot.
Right, a lot of people don't know. If you're not trying, nobody really pays attention a lot of times, and so it's a good idea to start charting that and trying to pay attention to what's happening and if you are regular.
Okay, and should you be doing this more than on the calendar? Is this the part where you take your temperature and all of that, or do you wait until you're actually trying to conceive to chart the
you can
pattern
definitely,
of your temperatures?
The basal body temperature charting is very old information that we can use to tell if somebody's ovulating. They'll get a nice rise in the temperature the second half of their cycle post-ovulation from progesterone. So somebody can use that to see if they've got a nice ovulatory pattern, if they see that rise. As far as timing intercourse, you know, I think that's important to know kind of when is your midpoint, when do you notice some cervical mucus changes, and you can use the LH predictor kits, the over-the-counter ovulation predictor kits, to help you know exactly when your best time would be.
All right, so that's timing. Assess your biological clock.
Right.
I hate that one.
I know.
Mine's been ticking so long.
Yeah,
it's almost done ticking.
That one is challenging because, you know, peak fertility is before age 30. And a lot of people now aren't even trying before 30. So waiting till after 30, it's a good idea to recognize that things are starting to decline and to know maybe what are the issues, when do things really start to decline more quickly, how would you compare maybe to other, say, 35-year-olds? Do you maybe have more time or less time than an average 35-year-old if you're delaying things?
Right. Is there an age at which you would not treat someone, or is that too individual to know for sure?
Well, usually as ovarian reserve declines and the quality of the eggs declines, then we do start offering options like donor egg, where a younger woman would donate an egg because the older eggs don't work quite as well.
Okay. Number 7, talk to your partner. Are you on the same page, and how long should you try before you go to a fertility specialist?
Yeah, you know, a lot of times I find that there's resistance, obviously, to going to see anybody and get help, and lack of information about what would be normal. What we see is that you're the most fertile, you know, when you start trying, and as time passes, the chance of you getting pregnant is actually dropping. So there is some information that's important from the duration that you've been trying. So after, you know, 6 months, if you're 35, your chances are about half they were compared to when you started, and so it's a good time to say, come on in. And I think sometimes women may intuitively know that a little more, and men maybe not so much, but it's a good idea for both people to be on the same page and come in.
Okay. Number 9, stop bad habits. Tell us what those are.
Well, you know, for sure smoking. So we have a lot of data for women that smoke cigarettes that their success rates are going to be basically cut in half. So getting...
Wow, that's really severe. That's a lot.
It's a lot. So I think it's all the other products that are in cigarettes as well. So the different chemicals, and so that really is significant to get that out of your system about 3 months prior. It's about how much time it takes to wash out. And then other things certainly like alcohol, medications, heavy caffeine use, we recommend discontinuing.
Okay, and then number 10, fertility doesn't improve with age. It's not cheese, it's not wine, so don't wait.
That's right. I mean, that's the key, is that, you know, as you've delayed trying to start, it's important then you try for a while, because it's going to happen for a lot of people naturally with no effort and no help. But then really fertility clinics are really just to assist and to look for problems and then really help somebody have their best chance. And so there's a window of time when we can do a lot, and then a later window of time when we can't help as much.
Yeah.
The options change.
So getting in there is important. Dr. Thayer,
Right.
thank you so much.
Sure.
And there's nothing better than when you want that baby and that baby arrives. So
Right.
we want people to get that sort of help. If you'd like some professional help with conception or have questions about fertility, please consider consulting our friends at Seattle Reproductive Medicine. You can reach them by visiting our website, king5.com/new day. When we come back, we're getting the lowdown on a brand new dance show coming to the Moore Theater, a super high energy performance that is coming up next. Thank you so much.